We would like to present our experiences with Simeox during the planned hospitalization of our patients with cystic fibrosis. We are going to share this presentation together with our respiratory physiotherapist, Chmelařová. We would like to present you a case of our 18-year-old male boy or a patient with cystic fibrosis. As to his medical history, he was diagnosed with CF at the age of 5 months. And as you can see, he already had the protracted dry cough, right lower lobe pneumonia, and there were signs of pretty severe malnutrition during that time. At these days, the newborn screening program was not available yet in our country. So his sweat chloride test was highly positive. His genotype is he's homozygous for the delta F08, and he's pancreatic insufficient. On this slide, you can see the photography this is the latest photo. And this is the photo from the time when we started the Simeox therapy during this planned hospitalization. He was already colonized chronically by Staphylococcus aureus, unfortunately even with the Pseudomonas, intermittently with the Stenotrophomonas maltophilia. And we recognized the exophilia dermatitis in 2020. That was after this planned hospitalization with Simeox. And we intermittently treated him due to his aspergillus infection as well. The situation was a little bit complicated even due to the ABPA, which was treated during the year 2019 with pulses of systemic steroid therapy. There were signs of malnutrition and growth impairment at that time when we started the Simeox therapy. You can see that his body mass index was 15, and you see his weight and height at the time. On this slide, you can see the CT scan where there were signs of mucus plugging and the bronchiectasis and even, even the atelectasis of the right lower lobe. And the patient was expectorating and producing a lot of sputum. His strength of his pulmonary lung functions in terms of FEV1 values. So you see that his lung functions were declining slowly since 2018, and during 2020, here is pointed with the blue circle. That was the time when we initiated the Simeox therapy. At the time, his medications were pancreatic enzymes, vitamins, and probiotics, and we started later the Orkambi therapy in February 2021, and his regular inhalations were 6% saline solution with salbutamol as the premedication, and the long-acting beta-agonist agents and pulmozyme once per day since 2013. So Anna is going to continue about the information of his respiratory physiotherapy.
So, hello, here comes the physiotherapy part, and I would like to tell you something very briefly about our patients' established home respiratory physiotherapy sessions. He usually starts with upper airways irrigation, which is very important for this particular patient because his upper airways are usually very congested. Then the upper airways irrigation is followed by inhalation of the medicaments mentioned before. And I, as a physiotherapist, usually focus on correct inhalation technique and positioning during inhalation, and mainly on his left side because of his hyperventilation of the right lung. The airway clearance techniques are usually performed with PerioPEP, and I think it's probably the only device he uses regularly. So as for Simeox, our patient's first experience with Simeox was in February last year, and it was during hospitalization for the acute exacerbation. And during the hospitalization, we could see excellent clinical effect. So based on this experience, we asked our CF patients organization to lend him this device for a month. And as a result of the benefits, we also offered the family to the 2-week hospitalization on our rehabilitation ward. And I would like to also notice that, or to say that we also offered this hospitalization to the family because we also wanted to take the patient out of his, let's say, non-ideal family circumstances in terms of cooperation. So the key problems we focused on were mainly mucus stagnation in his right lower lobe, then decreasing spirometric parameters, limited chest expansion based on measuring respiratory amplitudes, bulging of the abdominal muscles, as you can see in this first photo here, and overall postural dysfunction. So during the hospitalization, we provided physiotherapy twice a day. The first session was usually physical therapy, and we were focusing on correcting posture and improving muscle imbalances. And we were using mainly manual therapy and also exercises for engaging his core muscles. The second therapy was respiratory physiotherapy, and we focused again on inhalation technique, thoracic expansion exercises, but mainly we performed therapy with Simeox. The therapy was very well tolerated by the patient, so we are able to perform two therapies with Simeox daily, and that means one was provided or under supervision of the physiotherapist, and the second one, the patient was able and capable to perform it by himself. So as I said, therapy with Simeox was performed twice a day, and we were using these positions. Here you can see on the left, upright sitting and then reclined sitting position, then lying on both sides, and then prone position. During the patient's exhalation, we were guiding the chest to help the patient to exhale properly and to reach the expiratory reserve volume faster. The power was initially set on 100%, and it was decreased gradually during patient's exhalation to 25% to maintain the signal within the peripheral airways. And as I said, it was very well tolerated by the patient. So here you can see the results. And as you can see, the improvement was mainly in the peripheral airways, MEF 75, 50, and 25, and also his vital capacity increased quite a lot, we would say. So here we can see a comparison before and after the 2-week hospitalization period. And I think that all of us can notice the difference mainly in his in the position of his shoulders, which are really protracted here in the first one photo, then and shortening his pectoral muscles. And I would like to also emphasize the position of his chest, which is, you can see it, which is quite in a cranial position here. And in the second photo, we can see how his abdominal muscles are engaged. And I think it's even more obvious here in these photos. The first one, we can see the protraction of his head, shift of the chest backwards, and bulging of abdominal muscles. and it's significantly improved in the second photo. So just to sum it up, we managed to enhance the spirometric parameters. We improve airway clearance, which is, I can tell it because I could see the patient that he was not able to cough something out in the last days of the hospitalization. And I could also the fluent chest expansion, improved function of abdominal muscles, and straightening of the spine, and released muscle imbalances. So that's all. Thank you for your attention.